Good morning, everyone. I am Malavika AK, MSW student from Sri Shabadisha College, Murugamar. Today, I am taking a section on healthcare system in India. In this section, we are going to be discussed about what is a healthcare system, what are the major healthcare organization we have, and what are their functions and what their responsibility and their duties. In the first line, we are going to be discussed about what is healthcare system. A healthcare system is an organized network of people, institutions, and resources that deliver health services to meet the people's medical needs of a population. Maybe it includes hospitals, clinics, and health workers and government programs that work together to prevent diseases and promote health and provide treatment. The main goal of a healthcare system is to ensure that every person has to access equality medical care and regardless of their location or income. It covers all the levels of care like primary care, it is a basic care, and the secondary care, and it is was in specialized care, and the third one is advanced care, and it is a play a role in improving the overall health and well-being of society. There is three levels of healthcare system in India. The first one is central level, and the second one is state level, and the third one is district level. On the other hand, there is also a local healthcare system is also. The first one is central level. In the central level, it was divided into three. First one is Union Ministry of Health and Family Welfare, and the second is Central Council of Health, and third one is Central Family Welfare Council. So we can discuss about it. First one. First one is Union Ministry of Health and Family Welfare. It is a comprised of three departments. First one is Department of Health and Department of Family, the Department of Indian System of Medicine and Homeopathy. And what are the functions of the Union Ministry of Health and Family Welfare is mainly is policy making and coordination and funding and national providing national health programs. The second one is Central Council of Health. The chairman of this organization is Union Health Minister, and the members is state health ministers, and it was firstly formed in the 1952. In coming to the function, the first one is to consider and recommend a broader outline for policy in regard to matters of health. And the second one is coordinating between the centers and states. And there is it to make proposals for legislation in the field of medical and public health matters and to lay down. For the third one, to make recommendation to the central government regarding the health, and the third one is to establish any organization with appropriate function for promoting and maintaining cooperative between central and state health and administrations. The last one is Central Family Welfare Council, and the chairpersons of this organization is Union Health Minister, and the members were the health ministers. It is a high-level advisory body in India, and it was Population and Advisory Council, and it was informed in the 1982. The major functions of these is means it does analysis the implementation of the program and accordingly advise the government. It was the headed by the Prime Minister. It is formed to review the progress of welfare programs, the welfare programs of family. And the second one is state level organization, healthcare organization. And there is also two types of state level organization. First one is State Ministry of Health and Family Welfare, and the second one is Director of Health and Family Welfare Services. First one is State Health Administration, which started in the 1990. The state list become the responsibility of the state, included provision of medical care and provide of health services and a pilgrim with the state. The organization structure for the State Ministry of Health and Family Welfare is headed by the Minister of Health and Family Welfare and Deputy Minister of the Health and Family Welfare. And for the Director of Health and Family Welfare Services, it is the technical work of the State Ministry of Health and Family Welfare. So we can be discussed about some of the history of these. First one is before independence, the medical and public health service at the state like at the center. We are also administered by the two separate departments headed by Surgeon General and Inspector General of Civil Hospitals and Director of Public Health Services respectively. But after the independence, these two departments were integrated to State Director of Health Services recommended by Dr. Bore Committee report in 1946. The State Health Director has a State Family Welfare is also known as Commissioner of Health and Family Welfare. There is a 229 State Family Welfare Bureau are functioning in various states and it is union territory in the country. The major functions of the state ministry of health and family welfare is policy implementation and state level health administration. And the director of health family welfare services is supervising hospitals and PHSC, implement national and state health programs, and provide preventive, promotive, and curative cares. For the district level, it was headed by the Chief Medical Officer of Health and it is advised by DHO, DMO, DLO, DFWO and civil surgeons. Let's come to detail. District is the ultimate unified administration for the all purpose and in our country there is 1597 almost districts. Each district is divided into two more subdivisions. Each district is under the administrative charge of collector. Each subdivision in the charge of assistant collector or sub-collector and each tahsil is in the charge of tahsildar. The areas of block may or not may be considered with the tahsil and there are about 60,000 blocks. It is in the charge of block development officer. It was called BDO and block will implement the community development program which includes health aspects also. Under the Panchayat Raj system and it is also local level healthcare system and the institution local self-government in rural areas. This refers to Panchayat Raj system. Firstly, it was introduced in the 1957 to link village to district to have people participation and strengthen administration at the grassroots level. It is comprised of three levels. You show at the slide. You can see at the slide, first one is village level, second one is block level and third one is district level. The village level is comprised of three things. First one is Grama Sabha, Grama Panchayat and Nyaya Panchayat. In the block level, it is called Panchayat Samiti and the Panchayat Samiti includes Sarpanchayat or Panchayat President, MLA and MP, representative of women and scheduled caste and scheduled tribes and cooperative society. This is also part of this. And the block development officer is actual secretary for the Panchayat Samiti and Panchayat Samiti is responsible for the block development activities under community development program. And the head of Panchayat Samiti maintain a liaison with the medical officer PHSC and CHSC provide help being requested. The block development officer is the ex-official secretary of the Panchayat Samiti and the Panchayat Samiti is responsible for the block development activities under the community development program. The head of the Panchayat Samiti maintain a liaison with the medical officer, PHSC and GSS and provide help when requested. In district level, the Panchayat Raj institution is chosen as Shila Panchayat. It includes following members like MLA and MP, representative of women, scheduled caste and scheduled tribe, two persons who have experience with the administration. And a district health organization head by Chief Medical Officer of Health. It is also called a CMOH and assisted by the number of officers. District Family Welfare, District Malaria Officer, District Leprosy Officers, and District Health Officers, and Civil Surgeon in charge in district hospitals. Each DCMO to become charge of one to third district for providing health, and the working group suggests the hospital to convert in the district health center which would monitor, promoting, preventing, curative service to be rendered to the 1 million population in the district. And next one we are going to be discussed about National Rural Health Mission. It is also known as NRHM. We can discussed about what is NRHM. NRHM seeks to provide accessible, affordable and quality healthcare to the rural population, especially the vulnerable groups. Under the NRHM, the Empowered Action Group, state as well as North Indian states and Jammu and Kashmir, Himachal Pradesh have been a special focus. The thrust of the mission is on establishing a fully functional community-owned decentralized health delivery system with intersectoral coverage at all levels to ensure stimulus action on a wide range of determinants of health such as water, sanitation, education, nutrition, social and gender quality. There are some major initiatives under the NRHM. First one is most important one. I think all of you know that what is ASHA workers, a health volunteers, and there is 9 lakh volunteers called accredited social health activities engaged under the mission, and it is for the link between the community and the public health system. The next one is Janani Suraksha Yojana. It is a short form is JSY. Major aim for the Janani Suraksha Yojana is to reduce maternity mortality among pregnant women by encouraging them to deliver in a government health facility. 7 million women benefit under this scheme, and cash assistance is also provided women who are but in a government health facility. Next one is Janani Shishu Suraksha Karyakram. It is also known as JSSK. For the main focus of this scheme is free maternity and newborn care, and it was launched in the 1st June 2011. All pregnant women deliver in a public health institution absolutely free and no expense delivery, including cesarean section also. Free endowments includes like free drugs and consumable and free diagnostic, free diet during stay in health institutions. And next one is village health and sanitation committees. It was formed in thousands of people annually, VHNC and under N. Next one is Village Health Sanitation Committee. It is also known as VHSNC. United grants of 1,000 are provided annually to each VHNC under NHM, which are utilized to involvement of Panchayat Raj representatives and other committee members in the states. And next one is Mother and Child Tracking System. It is introduced to be based name tracking system called Mother and Child Tracking System. It is a first time delivery of the antenatal and postnatal care service to all the pregnant women, immunization to all the children. The system also provides reference about the state of services, vaccination delivered to pregnant women and children under the MCTS, appropriate health promotion message to the beneficiaries. Next one is free drugs and diagnosis team, and to address the issues of high out-of-pocket expenditure, Ministry instructed the X15% of the states to envelope under NRHM to those states implemented free essential drug scheme for all patients accessing public health facilities. It means some of the family cannot afford the expenditure of the drugs, so the government take initiative to The 5% of the resource envelope under the energy those state implement free essential drug is must accessible for the public health facilities. Next one is Rashtriya Bal Swasthya Karyakrama. It is launched in the February 2013 and it is also focused on the child health screening. It can be identify the defects at the birth and what are the diseases the child who have and deficiency, malnutrition, development delays include disability. It can be identify any problem within the children. Next is Rashtriya Kishore Swasthya Karyakram. It is launched in the 2014 to reach 253 million adults in the country. Their women space and introduced pre-led intervention to the community level. The initiative broadened focus on the adolescent health program beyond reproductive sexual health brings in focus life skill educations, nutrition and injuries and violence, non-communicable diseases and mental health and substance misuse. Some of the things in is called give the awareness programs to the adolescents. They are the youth of our country. So it was very important. There are the national program under the NRHM. They are called National Leprosy Eradication Program, Revised National TB Control Program, National Program for Control for the Blindness, and the National ID Deficiency Disease Control Program. It is also under the NRHM and there is a NGO guidelines for the NRHM is it is a 25 have been issues to form their capacity building, support for community process and service delivery, develop innovation through research and documentation and advocacy, and for supplementary capacity in key areas of public health system, improve healthcare services delivery also. That's it all about NRHM. Major functions in shortly strengthen the rural health infrastructure, promote maternal and child health, integrate Ayushman and modern medicine, and ensure the inter-sectoral coordination like water, sanitation, and nutrition, etc. I hope all you understand about what I am saying. If you have any doubts, please mention in comments. And thank you for listening me.